So the Ebola virus. What is the Ebola virus? The Ebola virus is a deadly disease with occasional outbreaks that occur primarily on the African continent. It most commonly affects people and non-human primates. What are the different types of Ebola outbreaks? So the many people may not know that the Ebola virus has many different kinds of outbreaks depending on where that specific kind started. So there's the Ebola virus, the Sudan virus, Thai forest virus, Bundibugyo virus, Reston virus, and Bombali virus. So how did this virus start? It started, it was discovered in 1976. The first outbreak occurred in the Democratic Republic of Congo in a village near the Ebola River, giving it its name. The second outbreak occurred in the South Sudan, giving it the Sudan virus name. So what did scientists figure out about Ebola? So at first, public health officials thought it started by someone traveling from the Democratic Republic of Congo to South Sudan. They soon discovered that it was started in the area independently. So what factors could affect the spread of this virus? So population growth, encroachment, which means to invade into forest areas, direct interaction to wildlife. So on the side, I put a little picture of ways you can find someone who has it, ways you can respond to someone who has it, and ways you can prevent someone from getting it. So what symptoms does one get while sick with the Ebola virus? So symptoms are fever, aches, pains, weaknesses, and fatigue, diarrhea, vomiting, abdominal pain, possible bleeding, or bruising. And I included this picture of these people, these doctors working to help people in Africa with the Ebola virus, and this man who they are taking out of this trench thing is very obviously very weak and fatigued, and they just needed to save him from the effects of the Ebola. So, what preventions could one take in consideration when traveling to a country affected by Ebola? So, avoid contact with blood or body fluids of people who are sick. Avoid burial practices that include touching the body of someone who died. Avoid contact with bats, antelopes, and blood of non-human primates. So these things are mainly things you wouldn't do normally. So like if I were to visit Africa, a part of Africa that has the Ebola virus, I wouldn't normally just go touching someone who's sick or the body fluids of that person or touching someone who died. But these are things that could help people who are going to help in the healthcare world where they need it in Africa. So, how many people have been affected by this virus? So, it's very like, since this might be old information, it has varied a little bit. So, almost 29,000 people were affected and about 11,000 people died. So, I put a little map with statistics, but it's kind of hard to see. But about 11,000 to like 13,000 people have died is what I've read more recently. So is it the flu or Ebola virus? So a lot of people may mix up these two because they have very similar like effects on people. So the flu is a respiratory illness. It's mild to severe. Complications can lead to death. It's spread by people who have it coughing, sneezing, stuff like that. People who had it can spread it before and during their illness. Anyone can get it. Signs and symptoms develop within 2 days of exposure. Symptoms come on quickly and all at once. So, in feelings of a fever, headache, body ache, fatigue, cough, sore throat, runny nose, stuff like that are the symptoms. And then Ebola is very rare and deadly. It's found in African countries, so it's not normally found here. It's spread by direct contact with blood or fluid from a person who has Ebola or has died of it. Also spread by contact with objects that has touched the body fluid or blood of someone who has has died from it. Cannot spread in the air or by water or food. People most at risk of getting Ebola are healthcare providers who can care of patients with Ebola. So it's not very normal if someone here were to get it if they didn't help anyone with Ebola. Friends and family who have had unprotected direct contact with blood or body fluids of a person sick with Ebola. Signs and symptoms can appear 2 to 21 days after exposure, so they don't come on right away. And symptoms develop over several days and become progressively more severe. So, like the flu, all the symptoms come on all at once and like all, but Ebola, it comes on more progressively. So, when you're not least expecting it, it keeps growing and growing worse. People with Ebola cannot spread the virus until symptoms appear. So if I were to have it, but I had no symptoms, I couldn't spread it to someone else. Symptoms include fever, severe. I went over this stuff already, but yeah. Some more helpful, knowledgeable information. That is a diagram of how the virus gets into our system and it makes copies, so it spreads all over us. And then this is pregnancy after Ebola. So precautions to take if you're pregnant after having Ebola. And then Ebola virus disease, this is just symptoms, stuff that could, how it could affect you, stuff like that. So yeah. And then this is my sources. I got the pictures from Google. I hope that's okay.